Let's just quickly look at the complications of hemophilia. This is basically a summary of what we have been discussing through the clinical symptoms. The feared complications for which we start the prophylactic therapy in patients who have a severe hemophilia are generally degenerative joint diseases because of repeated or recurrent joint bleeds, bleeding into the brain, intracranial hemorrhage presenting in various forms. This can be life-threatening. Along with that, hematuria, if it is gross, it can lead to a large loss of blood, and it can also lead to clot formation in the urinary tract, which can basically lead to backward pressure or renal failure as well in severe cases. Along with that, certain types of intestinal bleeding can lead to intestinal obstruction in the long run with adhesion formations. And also there can be respiratory problems if there is a bleeding into the respiratory tree. For example, large pulmonary artery bleeding can lead to respiratory obstruction, or if there is a bleeding in the pharynx or the pharyngeal cavity, that blood can move into the respiratory tree and that can lead to respiratory obstruction as well. So these are the feared complications which we have in hemophilics, and they are generally present in those that have a severe form of a disease with very less factor activity. And to avoid these complications, we start prophylactic therapy in these patients with various types of recombinant factors, and we put these patients on those recombinant factors once or twice weekly for a long period of time, and that leads to a less propensity of these bleeding episodes happening.